So I'll call on you first, since you probably have tertiary issues and having suffered through many education committee hearings. I will give you a break today, not having to come back after recess. So,
Thank you, Mr. Chairman. Otto Faison, and I'm the wife of a Columbia teacher. We have 5 wonderful kids. She's at Columbia, but in 51 years, I don't think I've ever been accused of being a regular person or well-adjusted. So it's probably fitting that I testify at this time. I don't bring any additional moving stories. I bring a commitment from 34,000 educators within Missouri NEA. We care deeply about the success of children. We believe that proper health care for children and frankly for their parents is essential to making sure that they can be participating and successful in school. And we see the Medicaid expansion as helping families and helping kids. We think it'll help them be successful in school and life. We strongly support that. Be happy to try to answer any questions that you may have.
maybe you could work something out with the last guy who spoke about transfer issues and education in St. Louis. No, we don't want to touch that today. All right.
Always puts children at the center of education reform and policy.
Questions of this witness? Seeing that, thank you for your testimony here today. All right, we're just going to go on whoever wants to pop up first. If you think...
I was closer so I could pop faster. Very quickly, Mr. Chairman, my name is Catherine Edwards. I'm the Executive Director of the Missouri Association of Area Agencies on Aging. We represent the 10 area agencies on aging in the state of Missouri, 237 senior centers. And on behalf of Missouri's seniors, we would like to go on record in support of Medicaid expansion. We would also like to applaud your leadership and the leadership of Representative Torpey in bringing this issue forward in House Bill 1901, along with some very important reforms and transformation of the Medicare state system. We're in support of Representative Kelly's bill as well in expansion. Just 2 brief points. One is in our work as navigators, we are seeing a large number of people who are falling in the coverage gap. In the area of the Cape, for example, about 30% of the people we have been counseling fall into this gap. Secondly, the destruction of the rural health network in terms of hospitals would be devastating to our seniors, many of whom are living in those rural communities and depend upon those health homes. We thank you for the opportunity to testify today, and we'd be happy to answer any questions or provide additional resources in the future. Thank you, Mr. Chairman.
Thank you. Great testimony here today. Further witnesses? Mr. Lee.
Thank you, Mr. Chairman, members of the committee. Samuel Lee with Campaign Life Missouri, and I want to testify in favor of one particular provision in House Bill 1901 that I don't think has been discussed yet, and that's the Show Me Healthy Babies program. And you should have some written testimony that I've given to the Secretary of the committee. The Show Me Healthy Babies program in this bill would permit Missouri to cover unborn children in the state's health insurance program. CHIP was created by Congress in 1997, and Missouri passed enabling legislation in 1998. In 2002, during the George W. Bush administration, then HHS Secretary Tommy Thompson changed federal regulation that defined child for purposes of CHIP to include any individual under the age of 19, including the period from conception to birth. So since 2002, states have had the option to include unborn children in coverage in their state CHIP plan. Missouri, of course, as we've discussed, currently covers born children up to 300% of the federal poverty level. The Show Me Healthy Babies program would extend that back to before birth. Right now, there are 15 states that do cover unborn children. Missouri has never exercised that option, and this would be an opportunity for you to do that. CHIP is not an entitlement program. It works differently than some of the other programs like Medicaid. It's a block grant program where a certain amount is allotted to each state, and then it is, under this bill, it is subject to appropriation annually by the General Assembly. This was added, and we were thankful to the sponsor, Representative Torpy and Representative Barnes, and the co-sponsor. We're grateful to add this into this bill. It was originally introduced by Representative Griswold last year as a standalone bill. It was incorporated in a Children and Families Omnibus, and the House passed it last year by overwhelming numbers with bipartisan support. So it is something that has been before the Missouri House before, and it was approved unanimously by a Senate committee last year, the Senate Families and Pensions Committee, chaired by Senator Lamping. And so there has been bipartisan support for this provision as well. It is also part of the Senate, this year's Senate Medicaid reform bill that's currently on the Senate calendar waiting for debate. So just want to give you a little bit of context there, and certainly happy to talk more about it. But just want to thank you for including it in the bill. We think it's something that's very important and will expand opportunities for unborn children and their pregnant mothers to receive adequate health care in Missouri. I will add one unique provision in this bill, which is not found in the other 15 states. And I think it's particularly important in light of recent news reports from the Post-Dispatch and other places about the inability for pregnant women and others to access health care because of their inability to get Medicaid because of, well, for whatever reasons that are going on in the Department of Social Services. This bill would allow the department to have Missouri's 18 maternity homes and 57 pregnancy resource centers be a place where pregnant women, their clients, could enroll in the Show Me Healthy Babies program. With that, I finish my testimony.
Thank you. Question, resource. Seeing none, thank you for your testimony. I think there's a possibility we're going to finish and without having to come back. We shall see. So I'd like
Mr.
to
Chairman, I will be
keep
very
that
quick.
in mind.
I'm with Missouri Hospital Association, Daniel Landon, and it'll probably not be a surprise to you that we're hearing for these bills. Specifically, we support Representative Kelly's bill, 1239. We support 1969, Mr. Chairman, your bill. We have had some members of our association express some concern about the capacity of wraparound services in the CHIPS program, but we think you can work through that. And as I understand it today, on the docket is discussion of several subsections of Section 991 dealing with expansion. As I did yesterday, I think we would just make some technical comments. It's been said that the General Assembly, by virtue of not doing Medicaid expansion, is going to lose $2 billion in 2014. We've got a little kicker on our website, and last night it was at $450 billion. So I am very much interested in getting this done as soon as possible, if it is possible. But when I read on page 18, lines 111 through 114, it says that the Department of Social Service, Division of Rural Health Net shall promulgate regulations by January 1st, 2015 to set up an alternative benefit plan. They could not implement this law without breaking another. It takes longer than that to do an administrative rule. So it would be confusing to me if I were a state official to say, how could I get a rule done by January 1st? Now, we would hope that that could be done, but I just don't see how you could do that in a lot of time frame. My other
Particular governs the particular governs the general and statutory interpretation, but maybe we need an extra phrase in there to make sure that the ordinary rulemaking process does not.
I think that would be very much welcome. It's just, as it stands now, I don't see how it can happen. The other item I would raise is on page 19, lines 133. We're talking about coverage of populations through the exchange, but it does exclude the medically frail. And so then I would infer that then the state is making the choice, well, we're going to put the medically frail into Medicaid between the populations, between the incomes of 100 to 138% of poverty. That may have financial consequences because obviously if it's in Medicaid, we'll be paying the state share. just ask you to kind of think about whether or not that population could be equally well served in the exchange or not. And I would be happy to answer any questions.
Questions of this witness? Seeing none, thank you for your testimony, and as always, thank you for the particulars. Very appreciated.
Good morning, Chairman Barnes and members of the committee. My name is Jen Bursdale, and I'm the Executive Director of Missouri Healthcare for All. We are a statewide, nonpartisan, faith and community-based grassroots movement dedicated to the principle that every Missourian deserves access to quality, affordable health care. We have more than 8,300 individual members and 140 organizational members who have joined by endorsing that principle. I actually consider myself a regular person, and I spend a lot of time talking to really regular people. You heard from a couple of them today. They made the trip to tell you their personal stories. You also heard from some of the students who have spent the last couple of years talking to people throughout the state who have personal stories. I have in this box, I like to travel with accessories, witness forms completed by more than 2,100 regular people in the state who support Medicaid expansion. Many of them for moral reasons, for economic reasons, but a lot of them also because they or somebody they know needs expansion. I'm sure you'll be glad to know that they didn't all come here in person today to testify, but we did promise them that we would submit their testimony to you in hopes that you will read it and consider it as you make this important decision. There are so many lives on the line with Medicaid expansion, and we hope that the members of the committee and your colleagues in both houses of the General Assembly will do all you can to pass Medicaid expansion, and to do so this year. People are suffering and they really can't wait any longer. Thank you.
Thank you for your testimony here today. And the testimony. Questions? Seeing none. Further witnesses?
I'll make this as quick as possible. Hi, everyone. I'm Cindy Keel. I'm Executive Director of NAMI, Missouri. That's the National Alliance on Mental Illness of Missouri. A lot of the points I was going to cover have been very well covered today. I would like to speak briefly about the impact of Medicaid expansion on the lives of young people. The early adulthood is a very common time for people who have the genetic preponderance or for some other reason for young people to develop the most serious mental illnesses, schizophrenia and bipolar disorder. We know that if those young people can get into treatment quickly and get good, appropriate treatment, that we can prevent a lifetime of disability. So many of our people who develop a mental illness have gone on to the disability rolls because they had no way to pay for the mental health coverage. The way we are structured with our programs, there's a punishment for people who try to go back to work. They have to live in fear of losing their only access to medical coverage. And that's a big leap to make when you reach a point where you think you can work full-time, and to let go of the benefits. That's very scary because mental illness tends to be cyclical. And a person can be doing very, very well for 6 months, a year, and then have a relapse. And that relapse puts them back where they have to reapply and wait a couple of years before they'll have health insurance again. And then during that time, people can deteriorate significantly and perhaps never come back. So I do want to drive that point home. I also want to talk to the high cost of not being able to get insurance. And I'll just share with you very quickly, my brother-in-law lost his life about 3 years ago to suicide. He was a dairy farmer, very hard-working dairy farmer in Lawrence County, and he could not afford health insurance. And there were some downturns on the farm, and he had to lose his health insurance plan. Cost was a major factor for him in controlling his bipolar illness, and he had controlled it very well for a number of years. You know, life out on a dairy farm is pretty predictable. So this was a good match for him. But when he lost his access to health care, he turned to the only socially acceptable treatment for a man in rural Missouri with bipolar disorder, and that is drinking. A lot of our people with mental illness turn to alcohol and drugs as an alternative because they can't afford their health insurance and afford their medications. So, having said that,
I want to make sure we can get to everybody here.
yes, I'm going to stand down. Having said that, we can prevent a lot of drug and alcohol addiction if we will pass the Medicaid expansion. Thank you for giving me this time.
Thank you.
And I have written testimony here.
Senator?
Thank you, Mr. Chairman. My name is Pat Doherty with Catholic Charities out of St. Louis. I will hand you a letter from one of our directors who basically explains how important this is. Briefly, we have 165,000 people. Almost 75% of them are below the poverty level in 11 counties on the eastern side of the state. So many of them would be positively impacted if the legislature expanded Medicaid. So our plea, without even getting into the wonderful stories that you have heard today, is for you to proceed with the changes that you have and are in full support. Thank you very much.
Thank you, Senator. Further witnesses?
Brett McGinney with the Missouri Coalition of Community Mental Health Centers. Want to just go on record in support of 1901. Bring up 2 points. Cindy Keel did a great job covering some of the testimony I was going to present. We're passing around a little infographic that kind of talks about the expansion and what it means. 2 points though. We do have, sometimes it's brought up that if we don't expand, we just go another year and there's no harm, so to speak. We keep our current program. We do worry very much about potential losses of psychiatric inpatient beds in community hospitals. Our folks represent a very large number of uninsured, and if those Medicare and DISH cuts do happen, there's about 2,100 inpatient acute care psychiatric beds in the state. If we lose those and start to lose those, your law enforcement folks and individuals and families who need those beds are already having to travel very long distances sometimes to find a bed, and that could exacerbate that problem dramatically. So a lot of concern there. And then one other point I wanted to bring up, we read in the media recently that a House member was trying very hard to find like $8 million of state general revenue to fund the treatment court needs in the state of Missouri, and was working hard in the budget to find $8 million of straight general revenue to do that. If we would structure this thing right, with those kind of funds, we could fund through expansion and use those kind of dollars to fund other priorities in the budget. The same's true in the mental health budget. We have funds there too, although limited, that fund crisis services that if we structure things right, we could do with expansion dollars. So there's opportunities for real savings, real treatment, diversion programs that could save money. So with that, thank you.
Thank you for your testimony. Further witnesses, can I get a show of hands again? All right. Yes, there is a way. Me too would be.
I won't even sit down. Jessica Pabs on behalf of SSM Healthcare.
Thank you for your testimony.
Yeah.
The green light is on. Can you hear me?
Yes, I can hear you.
Good morning, Mr. Chief and members of the committee. I'm Norma Collins from the AARP Missouri State Office, here to express support for House Bill 1239 and House Bill 1901. We are particularly pleased that if Medicaid could be expanded, especially for those 50 to 64-year-olds who have lost their jobs or who are struggling in jobs that have no health benefits. So we just want to go on record in support of that, and I'll answer any questions that you might have.
Thank you for your testimony. Further witnesses?
Mr. Chairman, Jeanette Von Oxford from Missouri Association of Social Welfare. One of the things that we want to stress is that the federal poverty level itself is an outdated, inaccurate measure of poverty, and that one of the most important things that you can do in structuring any future program is to sit down and do the math and ask yourself, could I really afford a payment or a premium, a copay of this size if I had this particular budget? Sometimes we tell other folks, oh, go to a budgeting class and you can learn to do that, but we're really asking them to make a way out of no way. And it's very important that we use honest measures and numbers, so I ask you to work carefully on that. I would like to say something that you may not want to hear, which is there are folks who really expected that this would carry over because of the number of people who wanted to testify, and so they're already planning to show up later today, and that you may not be able to accommodate them, but there are other folks who hope to talk to you later today.
I'm not sure with our marathon hearing schedule that if we will have a full committee attendance at that point, representing further testimony.
I won't sit down either. Teresa Coyen, Cox Health. I'm actually speaking on behalf of the BJC Collaborative, BJC, St. Luke's, in Kansas City, and Cox Health in support. Thank you.
Thank you.
Mr. Chairman, members of the committee, I'm Mo McCullough. I'm here representing the Missouri State Chiropractors Association. We are advocating for inclusion of chiropractic in any Medicaid reform. I won't go over my testimony. I'll just make it available to the committee, if that's all right.
Yes, that is all right. Thank you for that.
One more. I'm also Missouri Psychiatric Association that is in favor of Medicaid expansion.
Thank you.
Sean DeBria, registered lobbyist from Missouri Center for Independent Living, on the record in support of expansion.
Thank you. To the extent that there are folks who change their mind and decide they want to testify later, the committee will accept, we're not closing the hearing today, the committee will accept written testimony from anyone who wishes to written testimony. No member, we only have 2 members of the committee left, so the announcement about next committee action needs to go to the whole committee. With that, we are done. We are done.
Great job.